Good evening, everyone, and thank you for joining us once again. And I understand and really appreciate that, you all have been keeping up with us from joining from Wednesday nights to Thursday nights. We have some changes in our days because we have done a little bit of rebranding. We have, as you can see in our EDM, that we have come up with a meeting VIPs program, and it is still brought to you by SAA Group, Singapore Asia Alliance Group, and what we will be lining up for you will be a 3-month-long program of exciting talks, and then more interviews, and then we have even lined up some interviews with the top VIPs, which is the leading companies in the emerging markets. As you all know, we are emphasizing on the emerging markets, and especially our SAA group is emphasizing mostly on Belt Road markets. So we give a lot of emphasis on Vietnam, Cambodia, Myanmar, Thailand, and definitely now, this few months, we are narrowing down to Cambodia market and the economy and the development of the market itself. So today's talk is a 4-part series of our healthcare talk. So over the coming 3 months, June, July, and August, we'll be featuring a 3-part series on, 4-part series, sorry, on the healthcare sector. So healthcare sector for a growing economy is really crucial and is a must-have, especially to have a standardized healthcare system where all the expatriates and foreigners feel at home, and to be in it is very important. I myself have worked in overseas before for years, and then when we really get sick, we really question the healthcare system. Are we safe? Is our income worth to stay in this country? Or shall we fly back for the health reasons? So there are many, like me, there will be a lot of people before investing their time, their money into emerging markets and then new economies. Healthcare is a crucial part that we will put into considerations. So I have a panel of experts coming in to talk about healthcare and healthcare standards later on. But before that, today's topic is affordable healthcare and how the Singapore standard of healthcare system regulations and compliances, how to bring these standards to overseas. This is part of the talk today. So in the panel later on, we will have 35 years of expertise in this healthcare sector, Mary, and then we will have Amelia and Joshua to talk about it. But before going to introduce them more details, we have a small short video that we would like to share. So this video is also related to healthcare system and how our Singapore Bank, DBS, has supported the healthcare system to go beyond our nations and then how it has impacted. So maybe it's a self-explanatory video. So we could play the video first.
I feel unnecessarily entitled due to where I was born. My gender just automatically entitles me to healthcare access, right? The fact that 3.7 billion people weren't born like that is fundamentally a social injustice that I do not believe in. I do not think is justified, and that's obviously why I decided to try and do something about it. I think there is where you see, real poverty coming from the UK. Going to university in London, you sort of don't realise how lucky you are. I went there, really obviously loved the experience and certainly changed my worldview. I ended up with an internship in a large pharmaceutical company looking at access to medicine, how to discount healthcare products but open up large customer bases in the process, so lower cost medicine to reach hundreds of millions of people in India. Absolutely fell in love with the concept of social business in healthcare and really just creating new business models to support health for all. Went back into the UK, focused on consulting, working for the NHS, and really saw how a health system could be structured and how digital health worked. So healthcare in emerging markets is incredibly difficult to access. We talk about Philippines or India, it's 60 or 70% of your health expenditures you pay out of pocket. Health expenditure globally pushes 100 million people a year into poverty. 52% of the world, or 3.7 billion people, cannot access any healthcare at all. So Reach 52 is a Singapore headquartered social enterprise. We focus on last mile healthcare access in rural areas. We work across the Philippines, Cambodia and India. And really at the core of what we do is we've built a number of technology platforms that allow 1 or 2 women in a village and the community health workers to provide better support. By that what we mean is collecting data on healthcare needs, organising rural health events, ordering medicines, ordering insurance plans, and really looking to bring healthcare services to rural areas through the communities themselves. DBS Foundation wanted to challenge us to grow faster, so we took all of the funding they gave us and we launched in India. We've opened an office in Bangalore and we wanted to work with 3 on-the-ground NGOs to launch this service, collecting data, connecting patients to government and NGO healthcare, as well as offering our discounted or affordable insurance and medicine products. And none of that could be possible without the funding and support of DBS Foundation. The last 5 years of my life have been some of the longest hours I've ever done, some of the longest weeks. But now as we start to make progress, the experience that we've got as an organisation really allows us to build quite a complex, comprehensive service in areas where no one else can. So yeah, really hard work is key to making good things happen.
Thank you. I would like to say thank you again for the DBS. And then now let's talk about today's talk. So today's talk, we are teaming up with Lions of Judah, and then more will be explained by them later. But before that, there's a disclaimer. Maybe you can read about it. So this is all based on our opinions, and then whoever involved in this webinar, we will be talking our views and our experience, and yeah, this is a disclaimer about it. And next slide. Yeah, so there will be 3 persons talking and joining with us: Mary, Amelia, and Joshua. So we'll go through Mary's profile briefly first. So Mary has been in the healthcare industry for more than 35 years. Although she doesn't look at that age at all, definitely for sure. So she is very experienced, and then she's also a nurse educator, clinical supervision trainer, and then she is also a healthcare regulator with MOH. Ministry of Health, government and private hospitals. She go through some auditings, and then she will help them to do all the compliances. And then she looks into regulatory compliances, not only for hospitals, but clinics and then medical centers as well. And she is a quality assurance auditor for healthcare sectors. And then she also implement and design hospital management systems. And Amelia Amelia, let me introduce her. She's also 25 years experience in the healthcare sector. She acts also as a regulator, sorry. She also acts as a regulator for MOH, assisting hospitals and medical clinics on the Act, guidelines, and licensing matters. She also trains and pre-qualify nurses for the industry, and then she do retrainings, and she developed SOPs and guidelines for healthcare workers, clinics, and she is also in touch with the day-to-day operations, and then she will do the implementations for startup as well on the healthcare sectors. And we will go to Joshua next for an introduction. So Joshua started off with a machinery consultant, primarily in the premium oil and fuel trade. But later on, he joined Mary into the healthcare sector as a business development consultant. And then he has brought the company forward also. And then he is also he also managed healthcare management teams. That means that when clients ask them to manage and then comply and structures, he managed the teams, and then his forte is in building management teams, project executions, and then planning and implementation of the projects. So yeah, so I will pass the floor to Joshua to introduce more about the company and then the feature services and how actually that to show the whole Belt Road and all the our Cambodian counterparts, Indonesian counterparts, and then everyone, how the Singapore healthcare standard is. Mary will go through with that also. So yeah, Joshua, it's all yours.
Thank you so much, Gina, for the kind introduction. And I hope everyone is doing well. So let's dive right into the presentation. You know, I'm excited to show you what our company is able to do and the journey that will come as well. Yeah, so later we'll be also introducing to you Mary and Amelia. They will go through a lot of the presentations with you all so that you understand an in-depth understanding of what LOJ Healthcare Consulting can do. Yeah. So our mission for healthcare is to provide and instill an end-to-end excellent healthcare service. So it's not just consulting as well, but also bringing in people who can provide you medical technology, medical equipment, because imagine if you want to start a hospital from ground zero, we have the capability to bring in everybody you need, staffing as well. Yeah. Our vision is to impart, guide, and nurture the crucial importance of excellence in healthcare, quality, and patient safety. So end of the day, when we leave our clients to their work, we want to envision that these qualities are running, auto-running. And when we come back for the follow-up, the next 6 months or the next few years, we also would like to see these values continuing to shine. Yeah. So we would also like to talk a little bit about us. We are a Singapore-based company. So the key people are Mary and Amelia. They are the people who are actually retired from the Ministry of Health. And altogether, they have done more than 7,500 healthcare organizations that they have done auditing with, they have consulted with, they have gone back and given advice with. So you could say they're pretty famous in Singapore healthcare scene, you know? Yeah, and we also give out premium products, equipment related to medical and also machinery as well. So we have two businesses. One is machinery and one is healthcare. Today, we're going to focus entirely on the healthcare industry. And admin, could you help me so that we can get our viewers to see our website as well? Yeah. So if you'd want more information on us, you could go to www.lojworld.com. Admin, could you help me to go to the homepage so that we get the viewers to see how it will look like when they first go in. Yeah. Yes. So this is our homepage. And in the homepage, you have the machinery consulting, and you also have the healthcare consulting as well. Yeah. So there's a lot to explore in it. There's a lot of information as well. Yeah. Admin, could you help me to come back to the slides? Thank you. Yeah. Yeah. So today we'll be going through a few of the contents that is mentioned here: about us, training courses, team services, facility water management, medical tourism. We will cover it in the next meeting, but we will go into it for the Singapore framework and the rising industry as well. Now, even the overview section will be touching on ISO standards. Mary and Amelia will be touching on a few other training concepts as well. And then I will come back for the facility water management in healthcare. And I'll be talking about the content page as well, contact page as well. And probably a little bit of contents, what we're going to share, something exciting next week. Yeah. So there are two kinds of businesses, healthcare consulting line of Judah we would always get into. Number one, it's greenfield projects. Now, what is a greenfield project? You will have an excellent example coming from Leiden Heights, which they will show at the end. Edmund will be hosting it as well. So you'll have a very good example of what is a greenfield. So greenfield project is, imagine you're an investor. You have a bunch of money, or you are an investment group, or you are a government organization, and you have a flat piece of land, and you want to start from scratch. Or you have a building that has not been related to healthcare at all. You want to go in, you want to renovate it, and you want to build a healthcare facility. Let's say maybe a 50-bedded hospital, or let's say maybe a 4-story, 60 patients, inpatients, nursing home. That is a greenfield project. Now, in a greenfield project, LOJ shines because we are able to train new staff. Let's say in Cambodia, you're building a new healthcare hospital, and you have a staffing issue, right? We can make sure we can interview these candidates who are coming in as nurses, as nursing aides. We can bring them into our training programs. We can train the team. We can also do consultations for the design of the hospital based on the practice, and we can rewrite the SOP. So these are the many different things we can do with the greenfield projects. One good thing with the greenfield project is we do not need them to bend to something new. We can create something new from the start. We can have a brand new branding. Yeah. So these are some of the good things about greenfield projects, and we can help to avoid the pitfalls. We have very experienced consulting teams as well with us who have gone through a large scope of different types of healthcare facilities, healthcare centers as well. So you could say that, for example, if you're going into a new city like Cambodia, you would need to do a population study. Later during this questionnaire, they will be answering a few things about a population study. What are the common diseases? So we need to do a population study. And based on the population study, the disease-oriented service will be built. So these are some of the things we can go through for a greenfield project. And I will also allow, if there's any questions, you can post to us. If you're an investment group, you want to start something new, a nursing home, maybe a cardio consulting firm. Maybe you would like to start a dental service. These are few centers that we can start, yeah, from the ground up. Yes. So Jason, admin, could you just go to the next slide? Thank you. Yeah. The next kind of project that we can work on is a brownfield project. Now, what is a brownfield project? A brownfield project is an existing healthcare facility, organization, or center that already has all the equipment. They have the doctors, the nurses, they have everything available to them, but they are bleeding. They're not doing well, or they would like to change to a different practice, or they would like to bring their standards up to international standard. Now, this is where Line of Judah Healthcare Consulting comes in. Now we will do a few phases, and these phases we would like to talk to you about it in the next seminar, where we will be conducting a case study, an example, and we will showcase to you what is a brownfield healthcare center. It's very exciting to know that. Imagine you're a business group, you would like, or investment group, you would like to purchase a hospital, you would like to rebrand a hospital from the ground up. Now, this is where we come in to find out what are the errors, what are the mistakes, or what are some things you need to tweak, what is something maybe you need to do a complete overhaul, you need to do a complete hiring process. We are there with you to handhold you through this entire process. Yeah. So one of our clients is a Precious Medical Center, fronted by Dr. William Chong. So Dr. William Chong had called us in because we needed some advice for them, for their non-compliances to be redacted, for us to help them through the entire process of consulting. So within a short 4 days, we managed to give them the consulting, talk to them about their design consulting, their SOPs, talking to their staff, rearranging some of the way they did things, and within 30 days, when MOH, Ministry of Health Singapore, came in, they were able to get no non-compliance, zero non-compliance. Now that is something that is very rare, right? And we managed to do it within a jiffy, 4 days. So you can imagine what we can do with a 200-bed hospital. Yeah. So we would like to talk to you more about it, and we would encourage you to come in for the next session, which is happening on the 10th of June. Yes. Now, I would like to hand over the time to one of our consultants, our principal consultants, Mrs. Mary Nelson. She will take over from here and she will go through the Singapore framework. Thank you.
Hello, everybody. I'm Mary Nelson here. And it's wonderful to see everyone together with us today. So what I like to impart is the understanding of quality. Why do we really need quality? Even when you buy anything, you look at the quality of the product. The same way you think about the service of the product, a service that you get. So in quality, the most important issue is how you receive it, how necessary is this quality? Is there a moral obligation that you have when you render a service, And it basically, quality is not an extra or additional service. We must understand that. That has been the very fabric of Singapore. A service quality has never been an additional service. It has been woven in our very system. So for us, even looking at a clinic, why do we have to just place a jug of water there? But we make sure someone serves the water to someone so that that action or that deed is actually carried out. We see that it's carried out. So this is something that we make sure that is delivered to the right person at the right moment. So in everything, if you look at it, there is quality standards. That's why Singapore's framework is very important. She's recognized for the standards that she delivers. And it's not only within the Southeast Asia, but it's internationally. So we have actually a benchmark. We have set a benchmark that supersedes many countries. And it's not only at one institution, it's all over Singapore. Every institution, even though it's a general practitioner's clinic, to a restructured hospital or a private hospital, every organization has to have her standards implemented for ensure that the regulations are maintained. So this is why Singapore is recognized for our framework, a well-established framework. Now with this, myself and my colleague Emilia here, we have a vast knowledge of Singapore's healthcare framework. So we are able to guide every organization that we go in. For instance, that I have conducted national-wide audits based on certain regulations. I have found the non-compliances, and we have actually delivered the results of the compliances to a vast group, or we call it the sharing session, with CEOs, medical directors, and we encourage them the good practices that we have seen. So this is something that we are able to bring forth, why we have the similar standard that is being maintained everywhere. Now standards, when we talk about standards, there are different ways we can adapt the standards. One is, of course, your licensing to have a clinic or a hospital or a nursing home or even a hospice. There are some regulations that need to be adhered to, and then you can get your license. So licensing is a basic thing. The second thing would be accreditation. You get a badge, you know, you get a badge. You said you follow all the standards, like for instance, the ISO standards or the JCI standards. So these are very important. The other thing is we talk about quality improvement. How can I better the quality of service that is finally delivered to the demographic area that we are living? So for Cambodia now, we see the anxiousness, the desire, the momentum that is needed to transfer the good quality standards in to reach out to the people. So we are able to do that. So Jason, admin staff, could you please help me with the next slide? Yes. So now if you look here in the slide, you see that we have actually a methodology. We have drafted a methodology that is unique to us for basic methodology, our framework, our core workflow, that is to identify and impact, educate and guide, nurture on the site, and evaluate and follow up. Today, I'm going to talk to you, myself and Emilia. I will be talking to you basically about to identify and impact, and Emilia will, on the other hand, will talk to you about to educate and guide. Yeah, can we have the next one, please? So, so from here, you can see that when we need to achieve international standards, we need to inculcate certain behavior patterns. We need to encourage our staffs, the team that we are dealing with, to follow those standards. And that can be difficult because they have to undo certain practices that they have already been doing for a very long time. And when someone else, another team comes in to guide them, they are able to adapt better. So that's when Lion of Judah healthcare consultants like myself and Emilia, with our experience, our vast experience, we are able to guide, literally handhold, and lead your organization to identify, to plan, and implement those steps that is specific to your organization. Why? So that you can achieve those international standards. We bring you up to the standards, your targets. Like in India, they have accreditation. They have this NABH accreditation, you know. So it's a National Accreditation Board of Hospitals. So they expect all the hospitals to have the same standard. And they have different ways of doing it. One is a pre-inspection. And then we also have the international health insurance companies, different things that help to bring up the standard of your organization. Then we have specific 6 domains of healthcare quality. You must understand, healthcare quality, as I said earlier, is care given at the right time to the right person, you know, and it should be delivered in the appropriate manner. So there are 6 very important healthcare quality domains. First, at all times, you must remember the safety of the patient, safety. Then efficiency, effectiveness, patient-centeredness, timeliness, and equity. So these are the 6 important domains that we have to look into. So from here, we understand we have to have a change, and the change is important in healthcare, especially in our new norm. Everything is uncertain. Look at it. It's so uncertain. We can't even gather together now. There's so much of change within this year and a half, to almost going to be 2 years. It's mind-blogging. And thousands of organizations want to have assistance to get innovative solutions that can control the cost, strengthen the employees' engagement, and of course, improve healthcare outcomes. So this is where Lion of Judah is there to help you. Now, Lion of Judah healthcare management consultants, we actually design, implement very complex changes that have sustainable results with real world knowledge, you know. So our consultants, myself and Amelia, we will serve the management, and we have operating roles within the hospital and healthcare systems, especially in the Ministry of Health, in our regulatory and compliance and audit divisions. We have gone to all the hospitals, audited, inspected, helped them through their processes, not only in the GP clinics, dental clinics, medical centers, specialists, hubs, general hospitals, private hospitals, nursing homes, and hospice. So with this, we were able to understand the challenges and how to sustain and make a meaningful change. That's why we offer a variety of services to improve your organization's operation, and we can make your dream come true. So, yeah. So from now, I'd like to hand over the time to Amelia. Amelia, over to you.
Hi, everybody. My name is Amelia. So other than what Mary had shared regarding the quality management, and as well as the type of services that you can provide, we're also thinking of training your staff, because they are actually an asset to your company. So we believe that to train your staff, we also need to tailor-make a program that is only catered to your hospital needs and not to other hospital needs, as it's not a general one. So we actually believe that in providing the program, we actually want to have up-to-date universal nursing skill that is being taught to your nursing staffs. We also want to have the latest infection control management that's being taught to your staff, as well as the quality assurance management. And also, we also strongly believe that to have client coming into you, we must also have a good service and experience relationship that we also can impart to your frontliner, which is, for example, your executive, other than the nurses. So other than training them, we also strongly believe that once we learn something, we also need to get some feedback and also get some assessment to get their understanding. So we actually also implement some competency assessment for your staff, because we believe that competency is the foundation for safe and quality patient care. Therefore, assessment includes evaluation based on a defined criteria beyond just following a checklist or just grading a test. We actually want to ensure that the staff that we train are able to demonstrate the skills. They are also equipped with critical thinking while accommodating to their various types of work schedule that's given to them by their nursing sisters or their nursing leaders, as well as how to best use their time during the time restriction that they have. Also, we also want to have program that can also incorporate the latest nursing skills that we actually can we are able to see from the internationally, to have a good communication skills, teamwork, and also have fun into this assessment, and not only a classroom-based learning. We also want to make it as fun as we can. Also to validating the needs of the individual as the nurse itself, and as well as the team, as a nursing team in the hospital itself. Okay, so moving on, we also want to educate the leaders in the hospital, because we believe that they are actually the person to lead the subordinates that is under them, the people that is under them. So we also want to tailor and gear these newly appointed nurses, or the current charge nurses, or in Singapore we call them as nursing managers or the clinicians, that they actually would like to kickstart their skills up to a notch. We actually believe that we also need to refresh their learning as time goes by, and to keep them up to the standards. So the charge leaders are actually promoted because of their clinical skills, because as the years goes by, they actually they are like piggy banks. That means they went through a lot of trainings, they went through a lot of in-service. So we believe that they are having a lot of knowledge with them. But we actually want to use their knowledge to upskill them further so that they can actually teach the new nurses, the new graduates, other than their basic skills they have to a higher level, so that they actually be of an asset, be of a bonus to the institution, that actually they can educate their junior nurses, and then they can actually bring them to international levels. These courses we also want to actually design with a learning architectural program that is, there is a team to build a charge nurse with a commitment and a strategy capacity in governance, in their leadership, and as well as the administrative skills and the management skills. These courses, we actually aim to develop their esprit de corps, which is critical as increasing complex issue demands, well-coordinated, multi-healthcare discipline solution. We also hope that these courses that we conduct are able to cover not only the basics, but also to cover them with, like, example like communications, conflict, budgeting, as well as to cover them with the related nations' law and regulation that they have in accordance to their leadership they have in their country itself.
So this is how we manage our standards in Singapore, which is very, very important, not only for the hospital, but also for the staff. The staff need to understand why we are so fixated on standards. Because if we do not ensure that we provide good quality standards, and our management of the entire hospital, if it is not ensured, that can bring a plunge to your finances. So there are many things that has to be foundational, is the foundation basis for any institution, and that is quality standards. And the management of it has to be implemented from the grassroots level to the senior management level. So that has to be inculcated, has to be drummed into everybody, why standards, quality management standards are vital for any healthcare institutions. And we are there to help guide any type of specialty, from a GP clinic, medical hub, operating theater, any department, even a nursing home. Over to you, Joshua.
Thank you, Mary. Thank you, Amelia, for that very comprehensive introduction as well. Even though it's just introduction, it was quite comprehensive. Thank you for that. Now, everyone, I hope that you're still well. Maybe you want to take a short water break, as I'm going to go into the next segment. Yeah. Rub something quick if you need to rub it, if it's too, if you're sitting on a chair too long, yeah. So, okay, maybe I can touch a little bit on facility water management. Now, I purposely put this slide up here, even though our other consultant, Henry, was not able to make it today. He'll probably come for the next seminar. But facility water management is something that is very important in healthcare. It's very important in healthcare hospitals, in clinics, in dental clinics, small ones, big ones, mega ones. It's very important. Now, why am I showing this? Is I want to show you the kind of caliber we have, what we are able to do. It's not just talking about the intangible service that we can provide, teaching, writing the SOPs and guiding you, but also tangible things like building design, which I will touch on the next seminar. So these are very important things that we have in healthcare as well. So for facility water management, we are talking about optimizing the performance of your CSSD, your hydrotherapy pools, your cooling towers, your boilers. Sometimes boilers have things that are clogged up. It causes pressure. It can actually burst the pipes, and also save your money and make it more profitable for you, so that none of your profits are actually going down to your cost of your facilities and expenses. Yeah. So we hope to also bring Henry for the next session. And Edwin, could you help me go to the next slide? Thank you. Yeah. Now, if you'd like to get in touch with us, I hope you remember how to type out www.loj.com. And you could also call us. There's a QR code to call us. You scan it. Please take time to scan the QR code. You could also, so for people who are looking to give us a detailed report of what exactly they want. Maybe you want to start a clinic. Maybe you want to start a healthcare facility, or you're thinking about going into healthcare investments. You have no idea, but you're thinking about it. Talk to us. So when you go on the website, there is a form that you can fill up, and a detailed form that you can fill up exactly what you want, or maybe you actually have no idea what you want. Just drop us a mail. We would be very happy to reach out to you, to talk to you, and to get to know you. And now, even if you're in another country, it's very easy for us to come on Zoom to talk to you about it. Yeah. So the next week's seminar, which is on not the 24th, but the 10th of June. Sorry, there was an error, but it's on the 10th of June. So on the 10th of June, we will be talking about space and interior design, talking about medical tourism, a rising industry. So how do you position yourself as a healthcare organization, coming into medical tourism? You have a Singapore system. Coming to medical tourism will be much easier for you. Yeah, and then we're talking about some case study examples, something like, let's say, case scenarios where you have a restructured, you have a greenfield project. We want to show you what we could do, and it's something very exciting as well. And we will also try to talk to you a little bit of the financial growth as well in investments and growth. Yeah. So thank you all for your time. And now I would like to hand it back to Gina. Yeah. Thank you, Gina, for the time. Yeah.
Yes. Thank you so much, Mary, and then Amelia and Joshua.
You're welcome.
I could see very well that Mary really talks about her industry, the healthcare sector, with real passions. And then I think not only as a quality standard surveyor, but she has a real passion in it to meet the standards. And I really hope that, people like Mary can go to emerging countries and third world countries, implement and then pass on the burden of standards and then quality to others. So, and there's this thing where she has mentioned benchmark that supersede the standards. I think that should be in mind of everyone in any, not only in healthcare, but in any sector of the business, and then in any sector, I think we should do our best in what we do, in such a mindset. So yeah, quite insightful. I got a few questions down here from the flow, and then let me just ask Mary to answer some of the questions. The first one is what makes Singapore healthcare system one of the best in the world? So what differentiates us from others, what is uniquely Singapore healthcare system that bring us as a medical hub be a success?
Thank you, Gina. That was very encouraging. I was flattered. Yes, I always had that passion to pass on knowledge to others. I don't believe in withholding knowledge. I always want to pass it on. I think Amelia has been she has been with me even in Ministry of Health, and I passed on a lot of things to her, and I'm so glad she has joined us. So yes, for that question, what makes Singapore healthcare system one of the best? Is that what your question was?
Yes. What differentiates us from others? And then it's like why we are successfully running as one of the Asia's medical hub.
You see, as you all know, Singapore, she went through a lot of difficult turmoil. If you look at it, when I go back to history, like when you showed Cambodia's history, Singapore had a very difficult time. 56 years ago, she was a little island that went through so much of war, civil unrest, confusion, literally torn apart. But something got into us. And remember, Singapore didn't have any resources. We don't have natural resources, you know. Cambodia is blessed. She's got lovely fields, beautiful fields, I must say. I'm waiting to get there, man. So basically what happens is people started having a hard work attitude and an attitude that we must do it. We can do it, you know. And what happened was, that's basically, if you look at it, I put in a little nutshell for you. There's 7 reasons why Singapore has become the best, not only in Asia, but in the world. Singapore, yes, if you look at it, in many ways, you know, I have my classmates and fellow colleagues who are all over the world. They ask me, hey, how do you guys do it, man? You know, even in the COVID situation, you are able to curtail everything. Even when SARS came along, after SARS was a big hit for us, but we made sure certain regulations, certain standards were immediately implemented. And we went to the ground root level to make sure every clinic or hospital had those standards implemented. So I'll put in a little nutshell for you. First thing we must always remember, healthcare must be accessible and convenient to all, irrespective of the status, all right? I understand and I know very well that WHO is doing a lot in Cambodia to get out to the rural area, you know, the eradication program of malaria, and you have so many issues, but there is a lot of work going on. So we must always remember it must be accessible and convenient. The second thing is Singapore Hospital, all the hospitals, every healthcare institution has set exemplary standards for healthcare. Their own institutions. They want to be one step above. What can I do above? You know, so that is the one. And it's not only about how can I cure, but how can I prevent? How can we prevent this from happening again? So education is also important, not only to the patient, but the caregiver. You see, so all this, there are many things that are very important. The third thing is, in the early days, little ones died of communicable diseases. And the mortality rate in Singapore in the early days, 35 years ago, was horrendous, was bad, really bad. If I take the data 50 years ago, there were at least 26 babies dying for every less than 1,000. But today, less than 2 per 1,000. So that is a miracle. Why? It's also hard work, effort taken. Then the fifth thing is we build a trusted brand that is recognized internationally. You see, we have, before the COVID came along, we have patients from all over the world, from Dubai, from Arabian countries, our neighbors, they just come here. They enjoy it here. Not only as a holiday, the wives go for shopping or the family goes for shopping, or the children go for entertainment. At the same time, they also have the medical care taken care. So that is also important. Are you trustworthy? How can I make my healthcare trustworthy? That's where the standard comes in. You know, you go up the bar. And then Singapore has developed, our government is excellent, I must say, the healthcare financing system to make sure it's affordable and sustainable. When I was in the Ministry of Health, I was in healthcare finance and I was doing auditing for the MediSafe audits, you know, because we have a particular framework for healthcare finances where every citizen, Singaporean citizen, is able to use that saving, the special saving that we have. I'll talk about it later sometime, and that how it's been used, and the insurance programs and all. So it can be used. A poor person can use their MediSafe or the to take care of a particular surgery or the delivery or things like that. So that is important, the finance framework. And lastly is a safe system that is has portable medical records for all government healthcare. Example, I'm in one hospital in the East, let's say, in a government hospital. And I travel somewhere and let's say I met with an accident. Just let's say I met an accident in the North. So if the ambulance takes me to the North, the hospital in the North can access my medical records, but it's all confidential because we also have an act. So everything is integrated in a circle very beautifully, you see? So that is the reason why Singapore's healthcare system is unique. And we trust it. We all trust it. So I hope that answers your question.
Yeah. Yeah, building a trust is very important. You know, it's the branding and the trust that people comes over and over again to us, I guess. So the next question is, how do we bring this Singapore system that is so unique, that what you have spoken about, and then duplicate it to overseas, you know? How could we bring this healthcare effectively for developing countries like Cambodia, you know? Is it very difficult, or do we look at timeline?
All right, that's a good question. It's a very good question. Now that Cambodia is developing very rapidly, when I look at your presentation, I see that there's a rapid development in Cambodia, and that is good. But at the same time, we must see whether the development and the progress is effective. There should be always effective planning. When you look at the graph, it goes up. At the same time, there should be a growth. You know, the growth should be there. So as we grow up, is our knowledge also increasing? So we have to see that. So it is not only in healthcare, but we also have to see whether the planning is meticulous. Meticulous for what? For better living conditions. So when that is meticulous, we not only think of healthcare, we think, as Joshua was talking earlier, we think about the water. We talk about hygiene disposal. Yes, I have a hospital, but where am I going to dump all my rubbish? But the rubbish in the hospital can be contaminated. You know, we have, in fact, there will be infected cases. Let's face facts. So where do I throw my rubbish? Do I just dump it somewhere? No, I got to think about that. I got to work with the government, you know? So all that has to be in plan. So we talk about the water, as Joshua was talking earlier. We talk about the hygiene. How do I dispose waste matter? And of course, as I said, it must be accessible. Healthcare must be accessible. So that is where we can coordinate, can work together with the client. And of course, the client has to work with the Cambodian government to make sure that pathway and that growth that you grow up, but at the same time, the knowledge is also increasing, you know? So that is most important. And of course, the most important thing, we must always make sure that there is a positive impact on the people and on the health status. This thing we must always remember, positive impact. When we bring change, does it bring a good thing, or does it bring chaos and confusion? You know, so it should work together, growing, causing good impact, and of course, stability and good health status. So this is something. The other thing that we have seen in Singapore is the compulsory vaccination system. As children, when we were, you know, we all had to get immunized in school when we were kids in primary 1, U2, right? Yeah, our time it was really strict. Everybody come and jab us, you know. And we could, so immunization is also very, very important, because now I know for a fact that Cambodia is working very hard, and she's at her last mile. Very good, fantastic achievement. WHO is saying that working hard for the eradication of malaria. Awesome job, really awesome. In Singapore, we don't have malaria, but we have dengue. And that's the same problem you guys are facing in Cambodia because of the rainy season. So what happens in Singapore is we have, remember I told earlier about preventive measures. You not only take care, you not only do the treatment, but you do preventive measures. So we have to educate. So let's say we have a patient who comes with dengue. They come here, we treat, but we give education. We will be teaching your staff how to educate, education program within the hospital. That's a good thing, you know? So all these are very important. And of course, we must remember that we must try to establish international standards, but at all times being obedient to the government regulations. That doesn't, you know, standard you can always take from another place, but you cannot disobey your government regulation. That is important. You can collaborate both. So I hope that answers your question.
Yeah, that's very good. In fact, I mean, the questions can go on and on. Yes. You know, it's such a unique topic, and then essential topic that we can talk. That's why we have 4-part series coming out. So, but for now, time is limited. So until we can meet again and we can question you again. Thank you so much, Mary and Amelia and Joshua for coming down. And then we hope to see you again soon next week. And currently what I will do is I will bring Emin on the floor. Emin is from Developers Office in Cambodia. So what Emin is achieving right now is to bring Singapore standard hospital into Cambodia. And he will explain more about it and then feature the locations and everything. So Emin?
Hi Gina, thanks.
Yeah.
So we actually is a developer from Singapore. So we actually have stepped our foot into Cambodia. So we are doing the Leiden Lifestyle and Medical Hub. So before I start, a bit of a disclaimer. So this is an overseas development. So there will be needs of extra, checks as well as research before entering. So a bit about myself. I'm Edmund. I'm from MSQM. So I have about 10 plus years of experience in the overseas market. So mainly into property. Yeah. So what we believe is into adding value to the community. So we have entered Cambodia since 2014, and we have done quite a few projects. So we basically bringing in the Singapore standards to Cambodia. So some of the completed projects that we have is like the Aruna Water Factory, as well as our MSQM Park, almost like a JTC in Singapore. Then also we have our data centers that we actually built in Cambodia. So in our journey, we actually came to realize that the Cambodia healthcare is lacking. So they lack in terms of human capital as well as the resources. So 70% of their healthcare workers are actually nurses and midwives. So a lot of training is actually required for them. And they're actually traveling out to like Thailand, Vietnam, and even Singapore for medical services, you see. So in the process of this, we actually came up with the idea of a Leiden Lifestyle and Medical Hub. So it's actually to be focused into general medicine, dental, oral, as well as aesthetic and gynecology. So we like to do the youth part. Okay, so this is part of a 3-phase project. So Leiden Lifestyle Medical Hub is actually the 3rd phase. So we actually have our first phase, which is Leiden Heights. We're also bringing a Singapore concept condo over to Cambodia. And then phase 2 is our Escort Singapore, is servicing the international hotel suites over there. Then phase 3 is the Medical Lifestyle Hub that we're actually doing. Yeah, so we're actually located in Orchard. Okay, just near opposite Somerset MRT. You can visit us at the center point. But before you visit, do give us a call for an appointment. Okay, or you can join our Telegram group as well. Okay, so before I end, I shall share a video about our project so that we can have more understanding.
Leiden Integrated Lifestyle Hub, the next generation landmark of Phnom Penh. Here you will find high-end residences, retail establishments, modern sporting facilities and advanced medical services, all housed within an integrated world-class environment. Located 5 kilometres northwest of Phnom Penh city centre and 10 kilometres from the international airport, Leiden Integrated Lifestyle Hub is conveniently served by an array of existing transportation networks. Nearby is a collection of established amenities such as Aeon Mall, the Premier Centre, Australian International School, Grand Non Pen Golf Club and its water theme park. Within the development is Leedon Heights Condominium, Leedon Service Suites, Leedon Lifestyle Hub and Leedon Medical Hub, all nestled within a lush and well-appointed landscape. Let us now begin our journey, starting with Leedon Heights Condominium. Fronting the main street are daycare and child enrichment services that will cater to young families. In the heart of the development lies a 50 metres lap pool, a large children's playground and many lifestyle-centric landscape facilities that will keep residents fully occupied. The Leedon Service Suites sits at a serene and exclusive corner of the development. Here you will be greeted at the drop-off by the concierge that will assist your every need. At the top of the podium is a 25-metre swimming pool that is reserved exclusively for the service departments. Together with a spacious gym, a business centre and a multi-purpose function room, guests will be well served during their time here. Located at the other half of the development is the Leedon Lifestyle Hub, where multi-level sports and lifestyle facilities await inside a cavernous podium. Rising above this podium is the Leedon Medical Hub. It houses Grade A office units, specialist clinics and medical suites, providing total wellness consultancy to both residents and visitors. The design of the development and its shopping aisle is meticulously crafted to be grand, wide and welcoming that leads to an internal atrium. At the centre of the podium is a voluminous glass-covered atrium lined with exciting retail and dining establishments that overlook into an event-filled amphitheatre. The podium houses a large multi-purpose arena that can be configured for different sporting and e-sporting events, concerts, seminars and sporting facilities, completing the overall vibrancy of the development. The Medical Hub, with its Grade A specification, is positioned and designed to exude a high level of professionalism. The medical facilities and clinics are built around the needs of the visitors, providing specialist services combined with the most advanced medical technology. Leedon Medical Hub will be the flagship of healthcare services in Non Pen. Integrated, well-connected and vibrant, Leedon Integrated Lifestyle Hub is poised to be the next landmark of Non Pen and will enrich you and your lifestyle way into the future.
Thank you, Edmund, for sharing. And then I would like to thank everyone for coming on the webinar today, and especially all the viewers on our Facebook Live and then LinkedIn Live as well. Thank you so much for viewing our whole topic and seeing it through. And next week, we will be having them over again for a second part of our healthcare series. We'll be covering more topics and then how economically our healthcare system can lead over to overseas market, as well as existing healthcare organizations, what they can do and how they can find their suitable partners in overseas market, how they can integrate in. And then, yes, we will have more quick Q&A sessions also. So if you can go to our Cambodia Investment Facebook page, please do leave comments and questionnaires if you are interested to post more questions for Mary and Joshua as well. And thank you so much again for coming through. And just a highlight, so next week again, as I mentioned, is a healthcare talk. Followed by a third week, we will have a feng shui talk on these Belt Road countries, and then how feng shui and property goes hand in hand. And yes, so we have a 3-month long of exciting programs, which we will feature the whole list very soon in our Facebook page as well. So please stay tuned. And once again, thank you so much for all coming down. And it's on Thursday, 8 p.m. every week. So please join in either live or with webinars. Thanks again. Bye-bye.